All right, at this point you've seen Chuck take you through the concepts of flexibility. What I would like to do at this point is take you through some strategies for static flexibility. We're going to go through a number of different strategic static flexibility stretches, and what I'm going to infer is the stretch on a basic level, the guidelines to that stretch, but then things that you might consider in order to slightly tweak that stretch so that your observation of what tissues are being stretched, and as we go through the cert, what sort of ideas you can glean from when we start to look at the entire body become more evident. But at this point, it's just a link by link, segment by segment view of how we might take some tissue and extend it in an appropriate manner. And so as I call Rod in to become the demo for these stretches, because he's pretty tight, I would encourage you guys at home to maybe try and go through the stretches with us, because at this point you may be sitting for a little bit of time, and it's always nice to kind of get up and move around and try to extend some tissue. So the first one we're going to look at is the soleus stretch. And as you can see in the pictures in front of you, we're going to establish the client or the athlete in this position relative to something that is structurally stable. So that could mean a machine, it could mean a wall. In this case, it's the chair. And what I'm getting the individual to do, in this case Rod, is perform a staggered stance. And so in a nice staggered stance, what I want to do is make sure that the footprint, make sure that the feet are pointing straight ahead. The key to this particular stretch, to the soleus, is I want a knee bend. So what you're going to see Rod do is bend the knee and then translate his pelvis forward so that he feels an effective stretch in through the soleus. This might mean that the individual has to take a broader stride length to get his pelvis or her pelvis forward a little bit more. The key to this stretch is a slight bend to the knee and a translation, which means a push, a movement of the pelvis forward. Some typical errors that you might see clients perform is too much excessive arch to the back to try to get the pelvis forward. That's not the case. You want the pelvis and the shoulders both to move towards your fixed object to get a nice effective stretch in through the soleus. Now, some tweaks eventually would be maybe you're tweaking the foot position, but at this point it's remaining straight ahead so that you're getting a nice sagittal stretch on that particular segment of the body. The next one, very simply, is the gastrocnemius stretch. It is very similar. We're looking at the same migration or movement forward of the pelvis, but this time what Rod's doing is he's still establishing his foot pattern so that it's straight ahead, but he's keeping the knee straight. Now, as you know from your anatomy, the tissues of the gastrocnemius influence and cross the knee joint, and the tissues of the soleus influence the knee, but they don't cross the knee joint. And so that's the differentiating factor, is that the knee in this case is straight versus the last stretch, which was bent. And so what you want to do is hold for the appropriate amount of time that's listed on your graph beside you, and make sure that the body line is tall and there's not a lot of excessive arch in through the lower back. From here, we're going to have an individual lying down. So I'm going to ask Rod just to lie down on his back. And what he's going to do here is a hamstring stretch. Now, the first thing that we want to establish is that the spine is in an appropriate position as we set up this particular action. So I'm going to have Rod make sure that his shoulders are comfortably positioned on the ground, make sure that his pelvis is comfortably positioned on the ground without an excessive arch to the lower back or an excessive flattening to the lower back. So we want to maintain the neutrality of the spine so that we can actually affect the tissues in an appropriate way. What I'm going to have Rod do is take his leg closest to the camera, and he's going to bring it up, and with his hands, he's simply going to cradle gently the back of his hamstring. With his foot in a dorsiflexed position, what he's going to do is, under his own power, he's going to lift his heel towards the ceiling as far as he can comfortably. Now, you might have individuals that can only go this far, or you may have individuals that can go a little straighter, and I'm not going to force it into that position. But the key thing that we need to be aware of is if they're moving this under their own influence and their own voluntary control, a lot of times they may want to impress you, which means they're trying to push it too straight, which means that you would see a discernible arch in the lower back or a shift in the spine that we simply don't want to see. We want to affect the tissues of the hamstring and the posterior chain without an excessive movement at the lower back. And so we'd hold that for the appropriate amount of time, and then he would relax, and then he would simply switch sides, realizing the effective and efficient spine position for this particular action. The next one here we're going to take a look at is the standing hamstring stretch. So in this case, I know Rod's run track, and he's a pretty fast guy, so he's going to get into that track stance that he used to assume was 20 years ago, 10 years ago. And what he's going to do is he's actually going to effectively, in this position, stretch his forward hamstring, in this case, his left hamstring. So what he's going to do is establish a nice tall spine. There's a reason for this. And he's going to simply push up with both legs and more on the toe on his right side and more through the heel on his left side, so that he effectively establishes a stretch in through the hamstring. He's going to hold it for the appropriate time and then release by squatting back down. If he wants to repeat this action, he will stand up again, push through the heel of his forward leg and the toe of his back leg, and establish a nice deep squat and then come back up. The key here is if you have a person that has an inability to stretch effectively in the hamstrings, what they will have a tendency to want to do is round the back. Now, we could say that, well, that's a good stretch for the erector spinae, but sometimes that's at the detriment of the discs in the spine. So what we want to do for safety's sake is maintain some neutrality to the spine, which means a taller spine, if you will. And so repeating that pattern will stretch effectively the hamstring without beating up the lower back. All right, let's take a look now at the abductor stretch. And what I want to do is get Rod into a cross-leg position. Now, if he's going to side flex towards me, what he wants to maintain is the hip that he wants to stretch. That leg needs to be behind. So as you noticed, he crossed his right leg over his left. Now, this particular stretch can be done very effectively, but a lot of times we see that it's been done very ineffectively because the pelvis has a tendency for individuals to be fixed, and every degree of lean is through the lower back, and so we want to make sure that does not occur. So establishing the footprint first is key. Having a comfortable position where you see Rod crossing his legs over one another is key. But within that, we want to make sure that the big toes on each of his feet can maintain ground contact. If he can't, what we would do is not get him so far, but maybe decrease the amount of crossover that he has. Once we've established that position through the legs, his big toes can maintain its contact in through the ground. What we're going to do is let his opposite arm, in this case his right arm, just naturally fall to the ground. But the key here is that to fall to the ground, he wants a shift in his pelvis towards his left. He does not want a side flexion of his spine because we're getting at the abductors of his hip. So what you should notice is a shift of his pelvis, as you do see right here, towards his left as his spine as a tall unit begins to tilt to one side. What I would recommend is that the head carriage follow the line on the shoulders. We wouldn't see this in a normal stretch because of the safety of the neck. So that just follows the line of the shoulders as it tilts to the side. You'd hold for a count, and then you might repeat to the opposite side. One thing that you can do to tweak the exercise to make it more of a chain stretch in the lateral chain, to make it more of a pronounced extensibility, is utilize your left hand as a driver coming over the body. So in this case, there's more demand for a stretch, and if the hips are at all tight, this may be too much movement for the lower back. So let's be cautious as we go into this exercise that we know that as soon as we use the hand, is there enough of a flexibility component to the hips to allow that to occur without getting too much motion in through the spine. Now the next one is for the psoas major. In this case, we're going to have the individual kneeling down. Now there's a couple of different key things that we can do. What we want to do is have a comfortable 90-90 position in the knees. What I mean by that is a 90-degree bend in the forward knee and of course a 90-degree bend in the back knee. Some people have their foot too far towards them or too far away, and what that's going to do is put them in too much of a stretch or not put them in enough of a stretch to be comfortable. So once you've established that knee position, the forward foot is pointing straight ahead, big toe on the ground. The key here is going to be raising the opposite arm. So in this case, his back leg is the right side, so he's lifting his right arm. The reason for that is he's bringing traction on the hip flexors that he is stretching. So what we want to do is we want to maintain the stretch in this position by lifting the arm. Now, if someone sits a lot and they're very tight in through the hips, as soon as they go to lift the arm, what's going to happen is they're going to have a tendency, if they're tight in these muscles, to want to arch the back to get this job done. If we see that the individual begins to lift the arm and concurrently arch the back, we're going to encourage that they keep, for the purposes of the current model of where they are right now, that they keep this arm down and they just bring the pelvis forward. They want to maintain the pelvis angle. They don't want to start to tilt it posteriorly or anteriorly too much, but they simply want to lean forward just slightly so they feel a stretch in through the hip flexors. If they can establish that motion, that subtle motion, and hold it without an arch to the lower back, then we might encourage them to bring themselves back to neutral, to lift the arm, and then to slightly move forward so that they can feel a little bit more extension and a little bit more stretch on the psoas major. The next one is a posterior capsule stretch. So for this one here, what we can do is grab a table, we can grab a chair, we can grab anything that's solid and it's high enough to allow the leg to come up. So in this case, we're going to grab this chair right here, and we're going to allow Rod to lift his right leg up. And what he wants to do is essentially rotate his femur to the degree that his leg is out to the side. If you have a very tight hip capsule and the individual, by lifting their lower leg up into a surface, if they have a limitation at the hip, what's going to happen is they're going to start to torque at the knee. In other words, their lower leg has to get up onto a fixed surface that's too high. There's limitation at the hip, so the knee is forced to go through too much torsion. If that's the case, we reduce the height of the surface that we're stretching on. From this position, you want to make sure that the spine is tall, that there is a comfortable position and give through the pelvis. The way we're going to know that is there's not an excessive arch or hunch to try to get the leg up. If they can establish this position, what they're going to do is slightly lean forward with a tall spine so that they're leaning from the hip and they're not leaning from the lumbar spine. And they hold for a count, and then they would relax and switch sides. The next one is a thoracic spine stretch. So again, we're going to get back onto all fours. And what Rod's going to do is, again, establish a nice neutrality at the spine. The chin is going to be comfortably lowered so that it's just in line with the rest of the spine. His handprint is shoulder width apart, pointing straight ahead. His knees and hips and ankles are all bent at a comfortable 90 degrees. He's going to take one arm. So let's say he takes his left arm, and he's going to reach it through to thread the needle through and along the ground. He's going to allow his thoracic spine to be the guide to how much range of motion that this stretch gives him. If he had more range of motion, of course, he would just thread the needle more. If he had less, he wouldn't go as far in his guided movement to hold the stretch. So the limitation is going to be through the thoracic segments. It may be through some shoulder tightness here as well. So you're going to let that guide you to how far you go in this particular stretch. The key consideration here is you want to maintain some ground contact force here so that you don't fatigue the lower back. And you want to make sure that both knees are in comfortable contact with the ground. Hold it for a count and then repeat to the opposite side. Now in this same position, we can go through a nice latissimus dorsi stretch. So what we're going to do here is pick one arm. So let's say we pick Rod's right side. That arm there is going to be the top arm, or the top hand, as he stretches the lats. So what he's going to do is either go palms together, or he can stack them. We're going to go palms together, okay? And what he will do is he will stretch across his body so that it's towards his right shoulder, and he's going to extend both hands so that the palm of his left hand stays on the ground. And he is reaching directly anterior to his right shoulder. He's not going over top of his head. He's actually coming on a little bit of an angle to get more stretch in through this left lateral side here. So again, we want to make sure that the knees are comfortably positioned. If he wants more of a stretch, he simply sits his butt down towards his ankles. If he cannot do it, it is okay to have the hips up high so that his knees are essentially bent at 90 degrees if he doesn't have a lot of flexibility in through the lats. So again, taking into consideration how many sets and how much time, and he can switch sides after the hold to the one side. All right, let's take a look now at the levator scapula stretch. In this case, we're doing it in a seated or slightly seated position. The first thing that I'm going to have Rod do is turn his head slightly towards his right shoulder. What we're doing now is we're positioning the neck and the structures of the neck so that when he side flexes, he gets more of a levator scapula stretch. And he's going to take his right arm, and in a gentle manner, he's going to caress the crown of his head, and he's going to guide his head towards his right shoulder. Now, one of the things that we see a lot with clients that will facilitate their own stretch is they have a tendency to want to pull too hard with their hands. And so be very aware that as you articulate this stretch or as you cue this stretch to your individual, that you cue that they're gently guiding the neck towards the shoulder. And that will ensure that they're not torsioning or torquing the neck so much as to disturb the structures of the neck, because the discs in the cervical vertebra can be very sensitive. And if we rotate the cervical spine and then add some lateral flexion, that could disrupt some of the structures within the neck that we don't. We're actually getting at the muscles and not the actual physical structures of the neck. And so by moving it to the other side, he would just simply rotate his head slightly to his left shoulder, use his left arm to guide his head down for the appropriate amount of time to facilitate some extensibility in through the neck structures. We're going to take a look now at the pectoral stretch. What we need for this is we need something that's structurally stable. So we need a wall. You could use a machine, a doorway, anything that's an external force that's structurally stable, because we're going to apply a stress and a load and a stretch against it. So I will be that particular external force. So what we're going to have Rod do is take his right arm and position it up into a 90-90 position. So basically we're looking at a 90-degree position here and a 90-degree position here. Now if I'm the wall, what I'm going to have my client do, in this case Rod, is to take a step forward with the same side. The reason is because we're stretching the chest on this side, but the angulation of the tissue coming across to the opposite shoulder will elicit more of a stretch because of the fiber alignment. So I'm going to have Rod very gently position and move his pelvis, translate his pelvis forward until he feels a comfortable stretch in and through the chest structures. There is a caution here. In this position of the shoulder, you are in the weakest structural position for a dislocation. So if someone becomes ballistic in this stretch, which means they're bouncing in and out of this stretch, or they're very aggressively moving into this stretch, they run a risk of actually popping the shoulder structure out of position. And we don't want to do that. We want to naturally and gently guide the pelvis, and then the chest is going to follow. The thorax is going to follow what the pelvis is doing. We gently receive a stretch here, and then we hold for a count, and then gently move out of the stretch. We can't stretch a stress enough that this position in the arm is a very weak position, so we don't want to ballistically move into this stretch. The next one is, again, a seated or slightly seated position. We're going to take a look at the upper trap stretch. Now, a lot of people carry a lot of tightness here because of what we do day in and day out. We hold our hands up, typically at a keyboard or on a phone. And so that area there, fascially and muscularly, becomes very tight. What Rod's going to do is take his left arm and rotate it open so that it's in a neutral position and push it down. What he's going to do with his right arm is he's going to position his head so it stays straight, looking straight ahead, and he's going to gently guide his head towards his right shoulder. In this case, by pushing down with his hand and gently guiding his head with the opposite hand, he is effectively establishing some extensibility in through the tissues of the neck. Now again, we're using our hand here as a guide to just gently move the head to the side. We don't want to apply a lot of pressure because that disrupts or potentially disrupts the structures of the neck. What we are also doing here is we are pushing down with our hand to get some depression in the shoulder here so that we can actually have a good effective stretch in through the shoulder structures.